I think that we have come to the place where medical care, like education, ought to be available to every citizen, irrespective of their financial state.
Tommy Douglas, the man known as the father of Medicare in Canada, saw his dream become reality in the 60s, but with a catch that's only now sinking in. Nearly 90% of all COVID-related deaths in Canada are people over the age of 70. The pandemic proving that when it comes to the way we care for seniors, we've been getting it wrong for so long. That's the conclusion of André Picard's new book, Neglected No More. Just how the Globe and Mail's health columnist found the time to write it is another question. I caught up with Picard from Vancouver earlier today to talk about what's wrong and what better looks like. Okay, before we talk about the solutions, let's go to the core of this. When did Canada start screwing this up?
Well, I think like as in many things with healthcare, we're prisoners of our history. We grew out of the penal system, out of the prison system. The Elizabethan Poor Laws of 1601 are the foundation of this. And when people came to Canada, when they immigrated to Canada, they brought this system with them, which said that people who are poor are undeserving. And if they can't feed themselves, we're going to put them in a workhouse and they're going to work for their food. And that has been the case that existed in Canada, that approach into the 1960s. In my lifetime in Ontario, you could still be in a care home and have to work for your living and go into solitary confinement if you broke the rules. Places still had uniforms for older people who lived in these homes who were destitute. These buildings still look like prisons, let's be honest. And, where else do we put 4 people in a room? We do that in prisons. We don't do it anywhere else in society.
So how did we forget about the elderly?
Well, I think it's a part and parcel of society's ageism. When you become older, you stop being a productive member of society. And then we try and minimize the cost and we minimize you. We make you a second-class citizen. And I think what's wrong with that equation is we forget that all these elders have worked for 40, 50 years paying taxes. And when you retire, when you need help, that's when you cash in on this insurance policy. And that's what paying our taxes is. It's insurance for being taken care of later. And I think we've broken that social contract and we've done it in a horrible way. And that's one of the fundamental things we have to fix.
So how many times have we studied this? And how many recommendations from those studies have been implemented?
There's actually 150 studies that have been done on how to reform Medicare since the advent of Medicare in the late 1950s. Life expectancy has increased dramatically since the advent of Medicare. And everyone said, we got to do something. We have to prepare. And we never did. In Canada, we are world champions at writing reports and recommendations, but we're terrible at implementing them. I think we know all the solutions. We just have to start doing these things.
Okay, so what do we have to start to do, though?
Well, I think the first change, the most fundamental one, is philosophical. We have to decide that elders matter, that we want people, no matter how old they are, how many illnesses they have, we want them in the community. We want them to be part of our lives. Then you say, well, why are people going to long-term care homes? They're there because we have terrible home care, because we don't have subsidized housing for seniors, because we don't have simple things like someone to shovel their walk. People end up in long-term care homes at great expense and where they don't want to be for very, very simple reasons, like they can't take out the garbage anymore because they have trouble feeding themselves. All these things can be done in the community. They can be done cheaper and they can be done more humanely, and they'll make people happier.
So where is the model that we can apply here?
Internationally, the gold standard is Denmark. They did everything I've talked about. They said institutional care is going to be the last resort, only for the sickest of the sick. Everyone else is going to live in their homes. If they can't live in their homes, we're going to put them in these home-like facilities and take care of them. If you walk down the street in Copenhagen, family home, nursing home, family home, you can't tell the difference. People live in the community. We send care to their homes. We don't make them go off somewhere to get care.
And what about you in your own life?
Well, during the COVID pandemic, I lost my father-in-law, but he didn't die of COVID. He had been tested for COVID the day before he died. He was not well. Turned out he was negative, but he essentially died of loneliness. He was a very active man of 88, playing tennis 3 times a week, playing bridge, going to church every day, a fun-loving, life-loving person. The pandemic came along and his retirement home was locked down. So from between March and July, he just went downhill. He became deconditioned. He became depressed. He lost his vigor. He lost his love for life, all in this very short period. It's a reminder that, yes, COVID was devastating, but the consequences, the unintended consequences, were just as devastating for many people. People locked away, were so lonely and isolated. It was particularly hard on people with dementia. They didn't understand, why have my loved ones stopped visiting? Why can I see them outside the window, but they won't come in? Do they hate me? What's wrong? The isolation was so devastating for this population.
And you, Andre, how do you want to grow old?
Well, I don't. Like everyone, I don't want to grow old, of course, but I want to grow old being dignified. I just want to be able to live where I can live to the greatest extent of my abilities, whatever they are. However disabled I am, I want to be part of society. I don't want to burden my children. I don't want my children to have to be giving up their jobs to care for their father, because the system that he's paid into his entire life is not taking care of him. So we owe it to ourselves to improve the system, not just for our parents and our grandparents, but for ourselves and for our children.
Andre, thank you for the work you've done for Canadians, because this is a public service, this book of yours. Thank you.
Thank you.